Hello, everybody. Good evening, everybody. Without wasting much of our time, I want to teach you all about high blood pressure, type of high blood pressure, causes, and all that. So now we start from what high blood pressure means. So high blood pressure is when the pressure in your blood vessels is too high, which is above 140/90 millimeter per mercury or more than that. So it is common but can be serious if not treated. People with high blood pressure may not feel symptoms. The only way to know is to get your blood pressure checked. That is, it's better for you to be checking your high blood pressure to avoid being an increase which is at risk of causing heart attack, something like that. So another one is causes of high blood pressure. It can happen because of healthy lifestyles choice such as not getting enough regular physical activities, certain health conditions such as diabetes and, and having obesity can also increase the risk of developing high blood pressure. So without wasting much of our time, we are now about to talk about the symptoms. How will you will know that you have a high blood pressure in your body? So before we talk about that, I need to explain what this unhealthy lifestyle means. This this statement means what you take means when you are taking or not doing much exercises regularly, at least like 30 minutes per week per day. So that is, I know those one normally causes high blood pressure. When you are not doing exercises, it can cause high blood pressure. Then when you have something like diabetes, if you are not treating it or taking care of it regularly, that one from diabetes, it can also cause high blood pressure, too much of fluid in the body. So without wasting much of our time, we are second one is symptoms of high blood pressure. Number one is blurred visions. Then number two, nose bleedings. Number three, shortness of the breath. So number four, chest pain. It will make you to be having chest pain. If once you have BP or once your BP is high, it will cause chest pain. Then another one, which due to abnormal flowing of blood. Another one is dizziness. Then the last but not the least is headache. So now we are about to know the normal blood pressure. The normal blood pressure according to age. When your high blood pressure is high and when it is low. So let's start from normal high blood pressure according to age. So number one is adolescents from 14 years to 18 years. Their normal high blood pressure is 90 to 120. Then adult from 19 years to 40 years. Their normal high blood pressure is 95 to 135. Then adult from 41 to 60. Their normal high blood pressure is 110 to 145. Then other adults from 61 above, their normal blood pressure is 95 slash, that is 95 to 145%. So another one is classes of high blood pressure. I'm rushing because of time. No verse. Have mercy. Then classes of high blood pressure. Number one is diuretics, high blood pressure. So this diuretic high blood pressure is the one that is used to reduce fluid in the body. So it have many types of this diuretic high blood pressure. Number one is thiazide diuretics. Then number two is lobe diuretics. Number two is potassium sparing diuretics. So number three is osmotic diuretic and carbonic or hydrous inhibitors. So these lobe diuretic are commonly given for for flu flu retentions, which is edema, particularly in the lungs. So, so what this place means is, which is this loop diuretic. Some people, if you touch their body, it will be like say if you touch it, the thing will enter inside. It will be like say the thing is not alive. The hand, either hand or so. If you touch their body, the thing will enter inside. Then in some minute, it will begin to rise up again. That is what is called this lobe, which is odema. So it helps to treat that. And what causes that is BP. Once your BP is high. So number two classes of blood pressure is beta blockers. So without wasting our time, we are going to talk about the types of beta blockers. Number one is atenolol, which is also called denomine. So number two is bisoprolol, which is also called cardiocor or MCO. So the next one is carvedilol. Then another one are which is also called Trandate. So another one is metoprolol, which is also called Betaloc or Lopressor. So another one is propanolol, which is also called Indera or Angilol. So another one is Sotalol. All these drugs that I mentioned now is used to improve symptoms in other conditions such as irregular heart rhythms called arrhythmias and heart failures. So number three classes of blood pressure is ACE, which is angiotensin converting enzymes. Angiotensin converting enzymes. These are medicine that help relax the veins and arteries to lower BP. So example of ACE is inhibitors. ACE inhibitors are benzazepine, which is lutetium. So number two is captopril. Number three, enalapril, which is Vasotec, which is also called Vasotec. Then another one is fosinopril. Another one is lisinopril. Then another one is which is lisinopril, which is called Zestray. Another one is mosepril. Then another one is perindopril. Another followed by another one which is quinapril, ACT, which is etc. etc. So another classification, that is classes of blood pressure, is angiotensin receptor blockers. So these are used for chronic kidney diseases and prescribed following a heart attack. So these angiotensin receptors blockers, they are used to treat all these kidney diseases, heart attack, and all that. So without wasting our time, we are about to enter the types of angiotensin receptors blockers. Number one is azisatan, which is also called EDAB. So number two is candesatan, which is also called Atacad. Number three is aprosatan, which is also called Mesilat. So another one is tamesatan, which is also called Mecad. Another one is Vasatan, which is also called Diovan. So another one is Losartan potassium, which is also called Koza. So another one is Ibesatan, which is also called Avapro. Another one is Omesatan, which is called Benica. So without wasting our times, we are entering another, which is the fifth classes of blood pressure, which is calcium channel blockers. These classes of channel blockers are number one, benzodiazepines, which is also called diazem. So another one is phenylethylamine, which is also called verapamil, and the hydropyridines, which is all these amlodipine, bepiridine, felodipine, isradipine, nicardipine, nifedipine, and nisodipine. So another one is, which is the sixth one, is alpha blockers. These are medication that you use to treat bronchial conditions such as asthma and cough, and anaphylaxis, a serious multisystem allergic reaction. Number one type of this alpha blocker